Then we are going to discuss is your phenol or the carbolic acid. So phenol is basically antiseptic property. That's why we use in hospital, right? Hospital smell poisoning is seen in phenols. So antiseptic property, and putrefaction is delayed. Remember each and every point. So in phenol, putrefaction is delayed. Okay, it has an antiseptic property and can be absorbed through all routes. So causes hard leathery stomach. I told you it causes all hard leathery stomach. Remember I told you about this leathery stomach. So once this carbolic has been absorbed from the stomach, so it causes leathery stomach mucosa, and once if it is absorbed from the stomach, and it will go to the systemic circulation and it will reach the liver, where the liver will metabolize these phenol into pyrroketacol and the hydroquinone. Remember PH, so phenol, we have a 2-letter phenol, P for pyrroketacol and H for hydroquinone. So you can remember phenol has starting 2-letter, so pyrroketacol and hydroquinone. So these two byproducts are very much potent CNS depressant, and it will causes constricted pupil. Remember, it will causes constricted pupil and CNS depressant, and it is so potent. The byproduct of phenol is that the body started to excreting in the urine. So urine will be in a green color, and that is what we call it as a carboluria. Remember, carboluria. Carbolic acid, carboluria, green in color. So they will ask you, like the patient has came to the casualty with the unknown poisoning, and he is passing green color urine. What will be your probable diagnosis? What will be your probable patient has consumed the probable poison? Your answer should be phenol. And this phenol, this byproduct has started to getting deposited in the various tissues of the body, and this deposition of pyrroketacol and hydroquinone is what we call it as ochronosis, and it will causes it can causes renal damage and death of the patient, and blackish discoloration of the tissue wherever this pyrroketacol and hydroquinone get deposited. So this is all about the phenol. Remember, very important points. So it can be absorbed through all the route, even skin it can absorb. So this is very important, phenol or the carbolic acid, most commonly asked questions. So the next poison we are going to discuss is your oxalic acid or acid of sugar. Remember the different synonyms, it is very important. So in the olden days, this oxalic acid has been used as a forgery to sign the sign. In case of, like, it is an ink remover and it is a stain remover. So that's why people used to forgery the sign by removing ink. So this is most famous for forgery. Remember this, very important, oxalic acid or the acid of sugar. And once it reaches the body, in the blood it will bind to the calcium and forms the calcium oxide crystals, and these calcium oxide crystals has been excreted through the kidney. In the kidney it will envelop and combines, and it will forms the cast, what we call it as a dumbbell shaped cast. Okay, there will be the cast, different you can say different shape of cast will be excreting through the urine. So this is very important, oxalic acid poisoning. So systemic effect, oxalic acid combined with the calcium and causes hypocalcemia. This hypocalcemia is responsible for tetany, and now we are going to discuss about the hydrofluoric acid poisoning. So remember, hydrofluoric acid, I told you, this is the one inorganic acid, so which will causes the liquefactive necrosis. So why it is very important is because even if you applied this hydrofluoric acid on the skin, so it will causes local effect, and it will causes systemic effect through the skin also. So it will absorb through the skin, and it will causes local effect, that is deep burns, very deep dermal burns. And systemic effect, of course, systemic effect is basically hypocalcemia, hypomagnesemia and hyperkalemia. Remember these three things, very important, hydrofluoric acid. So moving on further, vitriolage. So vitriolage is basically act of throwing an acid into the body of another, that is causing a disfigurement. So this is very important, acid attack. So remember, most common acid which is used in case of acid attack is your sulfuric acid. Okay, that is called as oil of vitriol. So in vitriolage basically comes under the 326 IPC, 326A IPC. So if there is a acid attack, if there is an attempt for vitriolage, it is punishable under 326B. Okay, remember this is very two important IPC section you should remember. And if any patient of acid attack has coming to you for the treatment, doctor has to administer the medicine with a free of cost and inform the police. So if it is not done, it is called as violation and it should be punished under 166B IPC. Remember, very important, vitriolage. So I have summarized the most important points among the poisons. So remember these things, you should remember these things. These are must and known points. So up and above you can remember anything, but this is the must and know power points you should remember before you are entering into your exam hall. So this is very important. That's why I prepared my notes in such a way that you should not skip these points whenever anything which comes to your mind. For example, vitriolage comes to your mind, you should remember oil of vitriolage, and vitriolage punishable under which IPC, and acid attempt is punishable under which IPC, all these things remember. So very important.